Hey guys, today we're gonna go over respiratory rate and just going over the respiratory system in general. And we're really gonna focus today on sort of just introductory stuff on breathing and airways. So it's gonna be really simple. This is really supposed to be an introduction. So it shouldn't be too difficult. It's really introductory stuff. Just make sure you have your anatomy and physiology down a little bit. But honestly, as long as you have the airway anatomy up to speed a little bit, you'll be fine. It's really introductory, and this is kind of like the preface into the respiratory emergencies and all the problems. So there's a whole laundry list of differentials we need to know realistically on the field. You won't have to actually necessarily diagnose anything. You're not allowed to diagnose anything, but even then you won't have to know exactly what's going on. In a lot of cases, you're just giving oxygen based on their SpO2, based on their presentation, just in case if they look like they're having some difficulty breathing, you might give them a little bit, but this is just the introduction. It's going to be really chill, and it's going to be fun because this leads into the really cool stuff where you get to learn about the different conditions. You don't get to use it too much. That's probably more paramedic stuff, but you can know about it, and that's pretty cool, especially if you're interested in medicine and stuff like that. So let's get into it. Yeah, so today we're going to go over inadequate breathing. Inadequate breathing. And I kind of have just a laundry list. So when your body isn't getting oxygen, that's called hypoxia. So when you have increased hypoxia, then your body isn't perfusing well. It's not actually getting that oxygen. So there's two cases. Either your body's getting the oxygen and it can't use it, or there's a lot of cases where your breathing's just not good. So you're straight up just not even ventilating. You're not even getting the oxygen to the point of where it's near your cells in the bloodstream. So we're gonna go over a bunch of stuff. So the first one is brain function. So when you have no oxygen, your brain is not gonna work properly. So brain, and this is shorthand for function. And this is gonna lead to decreased mental status. Now, decreased mental status is obviously your brain isn't getting enough oxygen, it's not able to function properly, but there's a range of decreased mental status. So you might start with just we're just gonna do bullet points. So you can start with anxiety, and in every textbook, it's kind of labeled as impending doom. Now, what does that really mean? I'm not sure. It's kind of pre-stroke stuff, where before a person has a stroke, they have this thing, well, some of them have this thing called an aura, and not in the Gen Z sort of slang kind of way, aura, but in you are about to have a stroke, find help sort of aura. And it's where they can smell stuff, or they'll see different colors or something, is how it was described to me. And so this is kind of something similar. It's just a feeling. I wouldn't worry about it too much of what does that actually mean. You'll probably get used to it. So anxiety, confusion. In more serious cases, it can be it can get worse. So aggressiveness, and you might realize a lot of these signs are really vague, but also they're a lot like diabetes. So if someone has diabetes, or someone is taking drugs, they might have a similar situation where they're in this sort of state. They can be aggressive. If you, right after you give them Narcan, that's a little bit different because you gave them Narcan, but they might be aggressive. Or if they're drunk, they might have similar symptoms to low perfusion. So it's kind of where you gotta know what's actually causing their decreased mental function. And that's where you kind of have to look at the situation in many cases, but you can also just sort of you might be able to tell a lot based on that. That's why you also always get a blood glucose. You don't want to think oh, someone's drunk, but they're not actually drunk. They're just, they took too much insulin. Or not enough insulin, too much insulin. Next, I actually didn't know about this word, but it's called somnolescence. I hope I spelled that right. Did I spell that right? Somnolence. Nope, I did not spell that right. Somnolence. There's no S there. And there's no E there. Okay. That is one word. That is one word. Trust me. Okay, I didn't know what this was, but it's basically just sleepiness. And this is due to increased CO2 levels. So we're going to learn about carbon monoxide poisoning. And that's pretty scary stuff because like you won't see it, you won't smell it. We have like a beeper on our like Zoll monitors, on our EKG monitors. And it's just kind of like attached there and it goes beep, beep, beep if like there's high CO2 levels because you won't really know. And I've heard a lot of cases where like from other people that like apparently like you straight up just don't know. You walk in, everyone's having the same problem and you're like, what could it possibly be? It might be carbon monoxide. Next, we're gonna go into skin. So there's a lot of stuff we can look at for skin. The first thing is just like everywhere in your skin, you might see like a grayish, bluish tone. They might be like more pale, they might be more clammy. This is sounding a lot like shock because it is. That's kind of the reason. Shock is like where you have low perfusion. So if you have low perfusion, that means your cells aren't oxygenating, which is kind of similar to this situation with hypoxia, but grayish, bluish skin. And you might also want to like pale probably. And you might also want to look at specifically their nails, as well as their like mouth. So yeah, I wrote eyes here. I don't know why I wrote eyes here. Like, I don't know. On my notes, I wrote eyes. I don't know why I did that. But the next thing is your compensation. So this is your sympathetic nervous system response. So when you have low breathing, your body goes like fight or flight. It thinks it's under duress. And from this, you're going to get increased heart rate because if you're not oxygenating well, your body thinks like, okay, if I just move enough blood around, there will be like hemoglobin that's carrying oxygen and it will be perfused better. Next, you're going to increase your respiratory rate. And the last one is, sweating, also known as diaphoresis or sweating. Sweating works as well. And so that's just your sympathetic nervous system response. There's a whole lot of other stuff that your sympathetic nervous system does because it's like everywhere. Like it causes problems with like your gut. Like it's not problems, like it's good that it's happening, but it like decreases like your peristalsis, which is like that gut movement that like moves food around everywhere. So you will be like less hungry. What else does it do? Probably causes vasoconstriction. So your blood vessels will like constrict more, and I believe that pushes blood like stronger and moves it around more. So that kind of also is going to be related to heart rate. Yeah, so two big words you need to know are compensation, and this is the status of your patient where their body's like trying to fix the problem. And then there's decompensation, which I'm not going to write out, but that's where your body's just given up. Like if you see people in like movies where they're like freezing and they're not shivering anymore. So when you're shivering, that's your body compensating. By moving around, it's trying to like increase heat and try to like keep you alive. But when you like start slowing down, especially I'm kind of relating it to that movie example with like if you're in like cotton snow or something. If your body's like slowing down and it's not doing anything and it's like giving up, that's kind of like, okay, if you go to the gym at all and you have like a friend and you're spotting them on their bench, like if they're going up and they're struggling, that's like your body compensating, like it's trying. But when it's decompensating, it's when your friends like the bar just starts like moving down and you're like, they're not gonna get it and you gotta go help them. So that's kind of that's similar to what's going on now. So when your body's compensating, it's going to increase the respiratory rate. And when your body's decompensating, it's giving up. It's going to decrease the respiratory rate. And there's this big one, big word, agonal respirations. And these are like sort of like short gasps. So that's where they're not doing anything. Like it's not actually like helping you get more oxygen. It's like these rare short gasps that people take. And it's kind of like a precursor to respiratory rest. And it's just a sign that this patient is really not doing well. And it kind of looks like they're breathing a little bit, but it's very strange. Like they'll make a sort of like weird noise. It's going to be like a quick gasp, and it's not going to be as normal as like a normal respiratory rate would be. So that is everything for just like general stuff, but we're going to go over pediatric cases. So in our like protocol at my new station, they like don't, like half the book is pediatrics. Like they have everything for like your normal adult, and then they have everything for pediatrics. And like 90% of it is like the same sort of stuff, because obviously a lot of it's just like descriptions, but there is a lot of like important stuff for pediatrics that is like specific to children or like infants or neonates. So let's get into that. So real quick stuff, the airway is smaller, obviously, right? The trachea, which is like your windpipe area that goes down into your bronchi, it's softer, and it's more likely to be hurt or moved around by like trauma. And similarly, like your cricoid cartilage, or just your cartilage in general, as a child, is like, so this is like the thing that helps protect it. It's also where EMTs, like they look for your cricoid cartilage to make like a cricodectomy. I'm not saying that right, but that's like to put like to create like another opening in the airway in case there's like obstruction above. But yeah, so your cartilage is softer as well. So this just means more likely to be hurt by trauma. And your tongue, we're gonna try to draw this. Your tongue is relatively bigger as a child. It's relatively bigger. It's more likely to obstruct the throat. So that OPA is really important in children because it keeps that airway open, patent, and keeps their tongue away from blocking it. So that's a bit more dangerous. And then finally, the diaphragm is used more. So if you remember, you've got like your lungs, and you have this thing called your diaphragm. It's this muscle at the bottom that kind of separates the rest of the abdomen from your upper thoracic area. So you got your heart. And so this diaphragm essentially moves down, and it sort of pulls your lungs open more. So it like helps expand your lungs by just creating more space, and it actually is like connected to it, so it will actually like pull it down. So that's what the diaphragm does, and babies rely on this more. And part of the reason is because this actually creates a problem later on. And what's the problem called? Yeah, it's called seesaw breathing. So this is where your chest isn't as like fully formed, like it's not as like rigid in a child. So you'll have this thing where it's like a juice box. Like your diaphragm will pull down on a child. It'll pull down to like open up the lungs. But instead of like opening up the lungs, especially in cases where the baby isn't actually filling their lungs with air, it'll move down and it'll just kind of suck the air in, or not suck the air, but suck the lungs in with it. So their chest will be like, let's say this is their head, right? Their chest will be like this. So, okay, that was a bit weird. I'm not, art is not a talent I have, but right, so it'll be like kind of like this. So their chest will just be sucked down as their diaphragm is moving down. And so what's meant to like help you kind of doesn't work as well because their chest wall isn't as rigid. And obviously they're not filling in with air. Another thing you'll see common is like flaring of the nostrils in children, as well as the accessory muscles. So in between each of your ribs, wrong side. In between each of your ribs, there are like muscles here that like help open up when you're breathing. And so babies use this a lot more. And this is all related to like that chest wall. If your chest wall isn't as rigid, these are going to play a bigger role. And you might see like the accessory muscles like flaring more than normal. And it's kind of scary a little bit because you'll see their like ribs and stuff, but that's their body compensating. What you don't want to see is the last thing that we're going to cover. And it's not really something to see, but it's something to note that babies decompensate really weirdly. So if the way I heard it was like old people are like this, like they go like this. Like when things are going bad, they kind of like go down slowly. But for babies, it's kind of like you're fine, they're fine, and then so a baby, like if they like are going silent, you know they're in a really bad spot because that's not good. So they decompensate really rapidly compared to like adults and older people. So yeah, that's kind of everything I had. I think that's everything. So that's everything for like really introductory breathing. We're gonna cover the actual emergencies, which is gonna be really cool, like all the different like cases of like what can happen wrong. But yeah, that's everything for now. Thanks for watching, guys. Appreciate it.